Chapter 6.4 is all about healing of wounds and burns. So, just a friendly warning that some of these pictures may be disturbing to some viewers. So, discretion is advised. It is not pretty. So, first we have inflammation, which is a response to injury or stress. And blood vessels dilate and become permeable and may become red, swollen, and warm. Here you can clearly see that the left foot is swollen and there's a hint of red around this area. It is very puffy, so to say. It has become permeable compared to a normal foot. This is probably a ankle sprain, and from personal experience, this hurts, and mine turned out the exact same way. Okay, so when it comes to cuts, these are the levels in which a cut gets repaired. Cuts. So when it comes to cuts, blood vessels break, and they release blood to form a clot in the wound. As you can see here, this is a cut, and the blood that spills out clogs this up. Clots consist of fibrin, blood cells, and platelets trapped in protein fibers, and blood clot and dry tissue fluid form a scab. As you can see here, so everything that spills out from it, including blood and blood cells, they dry up and fill up the landfill, so to say. Epithelial cells beneath the scab bridge the wound. As you can see here, I don't know if you can see, they're pretty small. These are the epithelial cells that bridge the wound. And fibroblasts migrate to the injured area and secrete collagen fibers. So these are the degrees of burn here. Here's a first degree burn, which is also called a superficial partial thickness burn. Here is a second degree burn, which is a deep partial thickness burn. And here's an example of a third degree burn, which is a full thickness burn. So the difference between these basically is that the first degree burn is only an injury in the epidermis. Here's a great graph showing the epidermis, the dermis, and then what seems to be the accessory structures. At the second degree burn, you experience a burn of the epidermis and the dermis. As you can see here, the dermis and epidermis and dermis, sorry. And the third degree burn is a burn in which all of these layers are completely injured. And usually healing for a first degree burn, it only takes a few days, maybe even weeks, and there is no scarring. A good example of this is probably just a sunburn, nothing too serious. It gets red, inflamed. A second degree burn, healing depends on the stem cells. And skin can recover without scars, but that's only if infection doesn't occur within the injury. And lastly is a third degree burn. And a third degree burn is the most severe burn because healing requires a transplant. And in that transplant, the skin grafts may leave extensive scars, because basically what they have to do is they have to get some skin from either another cadaver or another part of their skin and transplant it onto this damaged area in hopes that the cells will join the transplanted skin. My sources were the textbook. Thank you.